What are the stages of wound healing? Have you ever wondered how your body repairs itself after an injury? Understanding the stages of wound healing is essential, especially in high-risk professions like logging, deep-sea fishing, and storm chasing. Injuries in these fields can be severe, and knowing how to manage them can make a big difference. Let's break down the 4 main stages of wound healing. The first stage is hemostasis. This is the body's immediate response to an injury. When a wound occurs, blood vessels constrict to stop the bleeding. Platelets gather at the site and form a clot by binding a protein called fibrin. This clot not only prevents further blood loss but also acts as a temporary barrier against infection. Hemostasis usually lasts from a few minutes to a couple of days. Next comes the inflammation stage. After the clot forms, white blood cells, mainly neutrophils and monocytes, rush to the wound. They work to clear out bacteria, dead cells, and debris through a process known as phagocytosis. During this phase, you may notice redness, heat, swelling, and pain around the wound as your immune system fights off potential infections. This inflammatory phase typically lasts from a few days to about a week. For those in high-risk jobs, managing infection during this time is vital to avoid complications. The third stage is proliferation. Here, the body begins to rebuild the damaged tissue. Fibroblasts produce collagen and other proteins that create a framework for new tissue, known as granulation tissue. New blood vessels form to supply nutrients and oxygen, which support tissue growth. The edges of the wound contract to reduce its size, and epithelial cells migrate to cover the surface, restoring the skin barrier. This phase can last from several days to a few weeks, depending on the wound's size and severity. Finally, we have remodeling, also known as maturation. This last stage can last from weeks to months, sometimes even up to a year. The new tissue strengthens as collagen fibers are reorganized to increase strength. Excess collagen is broken down, refining the scar tissue. Although the wound regains much of its original strength, it usually reaches about 80% of its pre-injury strength. Over time, the scar tissue becomes less red and more flexible. In high-risk professions, understanding these stages is essential. Wounds can be deep and complicated by environmental factors. Rapid first aid to control bleeding and prevent infection is critical during the hemostasis and inflammation phases. Knowing when to seek advanced medical care can also help avoid delayed healing or chronic wounds. Wound healing progresses through hemostasis, inflammation, proliferation, and remodeling. Each stage plays a specific role in restoring tissue integrity. For those working in physically demanding jobs, knowledge of these stages supports better injury management and recovery.